They've made great advances. They've made really good advances with the type of transfusions reactions, at least in first aid in the last few years, by including like visuals and stuff. It's not really essential, but it definitely is nice for people who benefit from, diagrams and stuff. I always go through just the name. Like the name always gives everything away, and in my mind, it's the most useful thing because they won't always give you a visual, but they'll always give you a name. And there's really only a few things to memorize here. An allergic reaction is immediate, of course, and you can think of anyone who's ever had to use an EpiPen or anyone who has any type 1 hypersensitivities and how quickly something goes off. So that's pretty easy to remember, and I won't spend much time talking about it. The only thing is that IgA deficient individuals should receive blood without IgA. They always ask questions about someone gets a blood transfusion, no known allergies, but they might have like celiac disease or something. And some people with celiac disease are IgA deficient, and all of a sudden they get this blood product and they undergo anaphylaxis or something. And the question is, what should have been done? And the answer is, I should have received stuff without IgA. Okay. For acute hemolytic transfusion reactions, well, again, there's really not much to think about. It's all in the name. Hemolytic, so you're going to have blood. Hemoglobinuria in terms of intravascular stuff, jaundice for extravascular stuff. And what's the main culprit? Well, you're doing a bad job with the ABO blood groups. All right. And so this typically happens not at the same time and at the same speed as the type 1 hypersensitivity, but what you'll end up seeing is something like this: fever, hypotension, and tachypnea every single time. Every single time. So what they'll only test you on is someone gets a blood transfusion and they'll say, a few hours later. Compared to the allergic type 1 hypersensitivity, will be, within a few minutes. Okay, and the difference again will be, someone, even if it's within an hour or something, it's a really fast hemolytic transfusion reaction, they're not going to undergo anaphylaxis, but they're going to go through this fever, hypotension, and tachypnea, and it'll be fast. Okay, and of course you have to look for jaundice, you have to look for hemoglobinuria, because stuff like that is going to differentiate from non-hemolytic transfusion reaction. Because in this febrile non-hemolytic transfusion reaction, you won't have hemoglobinuria, but you will have fever, chills, flushing, and it could get masked. It could resemble the acute hemolytic transfusion reaction in terms of having the fever and you're breathing rapidly and stuff like that. Of course, the big difference is going to be no hemoglobinuria. You're not going to have this kind of jaundice or anything. Okay. Now, what they love asking you about non-hemolytic transfusion reactions, febrile non-hemolytic transfusion reactions, you've got a bunch of white blood cells in the blood products. And if it's leuko-reduced, of course, leuko-white, leuko-reduced, getting rid of those white blood cells, you won't have this problem. Okay. So again, what are you going to see in these things? Febrile non-hemolytic transfusion reactions, they're not really that fast compared to anaphylactic or allergic type 1 hypersensitivity reactions, which are crazy fast. Those things can happen in a few minutes. Okay. Now, acute hemolytic transfusion reactions compared to anaphylactic reactions. You're not going to get anaphylaxis. It can be fast. Maybe you get it also within the hour or something. But the difference is going to be you're going to have hemoglobinuria or you're going to have some sort of jaundice. Now, comparing and contrasting febrile and acute hemolytic transfusion reactions, it's that the febrile non-hemolytic transfusion reactions are not going to be hemolytic. You can have the fever, you can have the tachypnea and stuff and whatever, but you're not going to have hemoglobinuria, and your liver markers aren't going to be the same. And then finally, transfusion-related acute lung injury. They love this question, especially in step 2. Anti-leukocyte antibodies. Okay. It's different from the febrile non-hemolytic transfusion reaction. Here we're talking about specific antibodies against the white blood cells, compared to just having these white blood cells. And they've done a really good job in this edition of talking about the 2-hit mechanism. That says, well, for whatever reason, these neutrophils are sequestered. Okay. And then they're activated. Right. They love asking you also, whose problem is it? Well, or whose fault is it? Obviously, it's the problem of the person undergoing the reaction. The transfused blood, though, that's where the problem lies. Okay. You don't get pulmonary edema, respiratory distress. So, the difference between a transfusion-related acute lung injury and all the others, although, you'll have tachypnea and whatever, acute hemolytic transfusion reaction, you're not in respiratory distress. And if you've ever been in the clinics or something, looking at someone, fever, hypertension, tachypnea versus respiratory distress, although they can have similar symptoms, it is night and day. So what they're going to ask you here is they're going to say, someone pretty recently, you don't have any hemoglobin, don't have anything that would make you think jaundice, all of a sudden, pulmonary edema, non-cardiogenic, look at an x-ray, everything's blowing up. And delayed hemolytic transfusion reaction. You can think of it just like an acute hemolytic transfusion reaction. The only difference is that it's going to be much longer, and they love testing the rhesus factors. And of course, it must be previously encountered, because you have to be sensitized to it, of course. So hopefully now you can understand how, just with the names, you can kind of match the symptoms with everything.